I am now going to go over an NG tube insertion. This is a clean procedure, not sterile. You'd introduce yourself, wash your hands, ask for the patient's name and date of birth, check it on their armband, explain what you're doing and why, let them know that it shouldn't hurt, but it will feel uncomfortable. Put them in high Fowler's position, and gather all your supplies. Again, clean the bedside table, gather an emesis basin, for them, a cup of water with a straw, pH strips, a few pieces of tape, a tape measure, the NG tube, a waterproof pad, and a syringe, which I think comes in the kit. And then you're gonna assess which nostril to put it in by having them try breathing out of each nostril. Whichever one they can breathe the best out of is the one you're going to use. Then you are going to take your tube and hold it up to the patient, and you're gonna start at their nose, go to the tip of their earlobe, and then down to the tip of the xiphoid process. And then most places you add like 1 more inch, and then mark that with either marker or a piece of tape. And then open up the kit. You want to lube the tip about 1 to 2 inches in water-soluble solution, and then you're going to start by having them put their head back and putting it in, and when you get to like the back of the throat is when you're going to have them tilt their chin down to their chest, and have them constantly taking sips of water, like just drinking and drinking. And as they're drinking, you're advancing the tube down their throat until you get to your marked spot. And then you would take a syringe and put it on the, first you would lightly tape it to their nose so that it stays there, and then get a syringe and pull out just a little bit of the stomach contents, and it should be like a greenish brownish color, and then you would put it on a pH strip to test it, and it should be less than 5 because it's acidic. And if that's good, then you would replace the like light tape you put, and you would put like a piece of wide tape, like it would start here and then wrap around to hold it in place. And then measure the tubing from the tip of their nose down to the end of it, and remark that line if that's where you stop, to make sure like that there's proper placement later on when somebody else checks or when you check. And then you would secure the end of it, have them like tilt their head and secure it so they have enough slack. And then document everything. You want to document the type and size of the tubing you used, the patient's response to the procedure, what nair you put it in, and the characteristics of the drainage that you had pulled out, including the pH, like the color, if there was a strong odor. Then you would just clean everything up.